Good afternoon, good afternoon, good afternoon, good afternoon. Oh my God, thank God it's Friday. I promise you I'm glad Friday's here. And we are having some technical difficulty today. We're a little delayed in what we're doing. Um, can y'all hear me?
Yeah, we hear you.
Okay, all right. We're super delayed today. But thanks everybody for joining us. I guess we're gonna make the best of what we have and try to roll with it. Uh, Today, we are bringing you two special guests today in honor of National Minority Health Month. Um, April is always National Minority Health Month, and one of the themes for this year is give your community a boost. And one of the things that they wanted to really highlight this year was the importance of individual roles and organizations play in the reduction of health disparities and improvement of health and racial equity in minorities and um, communities of color. And so we have two special guests with us today. We have, and they're no stranger to the podcast. They've been here numerous times. Uh, Dr. Jeniqua Duncan and Tim Brown, family nurse practitioner in the latter office. But before we let them introduce themselves, again, my name is Mark Calhoun. I'm Director of Social and Community Services for CareSouth Carolina, and I'm always here with my partner in crime.
Yeah, I'm Daniel Myers. I'm the MATHD Program Director for CareSouth Carolina. Just glad to be here today on this Friday.
Absolutely, absolutely. And so we're gonna let our panelists introduce themselves, tell us a little bit about themselves, and then we'll jump right into it. We can start, ladies first. Dr. Duncan.
Sure. Thank you, Marek. My name is Dr. Duncan. I'm a family doc by training. I serve as the Chief of Value-Based Care here at CareSouth Carolina, and I've been at CareSouth for 4 years now. Thank you.
My name is Tim Brown, nurse practitioner here at CareSouth Ladder. I've been here 5 years now. I received my education from Francis, man, but I was educated at CareSouth by great practitioners like Dr. Duncan and Dr. Smith and many more.
Absolutely. Thank you both for joining us today. Like I said, it's Minority Health Month, and it was important that we come on and just kind of have a frank discussion as it relates to men and women's health when it comes to those individuals of color. And if we could, as I said earlier, ladies first, we kick it off with Dr. Duncan. Dr. Duncan, can you just start by telling us just in general, what's important for women in general when it comes to their yearly checkups, and what are the things that they should be making sure that get taken care of yearly or annually or biannually to ensure that their overall health is optimal.
Sure. So I think the overarching concept would be to prioritize your health, to put yourself first. I think as women, we are always caretaking others, but fail to see where taking care of ourselves is a priority. So once you decide to make yourself a priority, depending on your age range, you will have different preventive services that you want to be aware of. So for our younger women who are still in their ages to bear children, you want to make sure you're having regular STD screening. If you are young in your teens and early 20s, you will want to definitely be having chlamydia screening. You will also, if you're sexually active, want to make sure that you're having HIV screening testing done. In terms of your cervical cancer screening, which is done by through a pap smear, it can also be done via urine. So lots have changed in women's health in terms of people considering their annual exams. So before, you would go every year to your family doc or your gynecologist to get a pap smear done or a gynecologic exam. And that's actually not particularly necessary now. Based on the testing that we have, you would require your pap smear every 3 to 5 years, depending on which test is ordered. So we talked about STD screening. We talked about cervical cancer screening. Immunizations are also important for women, particularly if you are in childbearing age. You want to make sure that you have immunizations before you get pregnant to help you have a more successful pregnancy. And then as you get into, I guess, as young middle age now, you want to make sure you're having your breast cancer screening done. Also colorectal cancer screening to make sure you're looking for any issues with colorectal cancer. So those are the biggies that come to mind, in addition to all the other ones that men have to do too. High blood pressure, diabetes screening, looking for issues with cholesterol, and also anything that might be in your family history that you may have to have additional tests for.
Okay, so that sounds good. You mentioned earlier chlamydia screening. I know, as you know, you being value-based care, that's one of the measures that you all look at. Why is that important? Why is there such a push for that particular screening?
Yeah, so the incidence of chlamydia infection is pretty high these days, and chlamydia and gonorrhea really run very closely together. They're bosom buddies, and so we really look for screening for chlamydia because sometimes if women have long-term infection that they don't know about, it can create issues with them conceiving in the future. And so you're untreated for an infection. And then when it's time to conceive, you may have issues. Additionally, the longer you have an untreated infection and yet you're still sexually active, you're continuing to spread an infectious disease without knowing it. So that's why it's a screening. Even if you're not having symptoms, we're still offering the test. And having that screening doesn't mean that you have to have a full pap smear. We're able to do that screening through a urine sample now.
Okay, thank you for that. We know that there are disparities out there among women of color. Could you kind of give us an idea of some of the reasons for that? Why? I know we've gotten better over the years, but there's still a gap between. There's still a disparity there. What are some of the reasons for that disparity, and how can we as a community help, and not just a community, also as an organization, help shrink that disparity?
Sure. So I guess I'll start with what has been studied and then also what I've seen in practice. In terms of, we've seen things about pain management and that African Americans are not treated for their pain in the same way that other ethnic groups are. And that their complaints aren't taken at the level of seriousness that others are. And so I think as an organization, as a healthcare organization, it's imperative that we trust our patients. We listen to what they're saying, and it doesn't matter whether male, female, orange, yellow, black, green. That if this is what their concern is, that we take that concern at face value. And I think kind of the most recent famous example of that was Serena Williams, and when she was after her pregnancy, and she had concerns and nobody was really listening to her. And it turned out that she did have a blood clot. And so I think the lesson there is to continue to assert yourself. And if you are not feeling heard and listened to, you need to find someone that will listen to you. There's, this concept of loyalty in healthcare, and I've been going to them for all these years, but that's great. And there's great reasons to be loyal, but if you don't feel like you're being listened to, it's time to find someone that will listen to your concerns.
Absolutely. Absolutely. And we had one of the viewers mention, especially in childbirth. Um, can you speak to that a little bit? I guess, is it maternal child health when it comes to childbirth and that disparity as well?
Yeah. So being pregnant is weird, and nobody on this webinar or on this format will know that other than me, because none of y'all have been pregnant. There are so many different changes that occur in your body during pregnancy, and so because there's so much variability in how women are affected during their childbirth, unless you are paying attention to what is going on with your body and you articulate that each time you go in, there's no way that anybody can do something for you, right? And so if you feel like something is abnormal for you, then you need to make sure that that is heard, because otherwise there's no way that that can get investigated. And so we still have this disparity about maternal fetal mortality within African Americans. So at higher rates, our mothers are dying in childbirth, and our babies are dying in childbirth. And I think a portion of that has to do with trust in the healthcare system, not feeling like you can trust the person that is taking care of you. I'm concerned about that. If you don't feel like you can trust the person that is taking care of you and your baby, then you need to find somebody that you can trust, open up to, speak to, and make sure that your concerns are heard.
Absolutely. Absolutely. That's some wonderful information. And like you said, if when your loyalty is good, but if you're not feeling like you're being heard by your clinician, it's okay to switch to another provider.
Mm-hmm. Yep. It's a relationship, and sometimes relationships have a start and a finish, and sometimes it might be time to find a new partner that will help guide you into the healthiest life and healthiest lifestyle that you need, and that's okay. But don't doctor shop.
Right. Right. And you just said an interesting word, partnership. Partnership. Why is that important between the clinician and the patient?
Yeah. Okay. So when you go to medical school, you don't also get a degree in mind reading, right? That would be nice if we could do that, but we don't. And so for the clinician, the physician or the nurse practitioner or the PA that sees you, to make a very educated decision on how to proceed with treatment for you, then you need to provide information, right? So you're giving information, whether it's your history, what are your symptoms, how long have they been going on, what's in your family, here are all my medications. Also being honest about that. If you didn't take your medicine, say so, but don't say that you take your medicines and then tell us. If we don't have accurate information, then we can't do what we need to do for you. So that's why I call it a partnership. Both sides have to be on the same accord and working towards the same goal, but also pulling their weight, right? So bringing the information, doing what you say you're going to do, and also on the medical side as well, that we say what we do what we say we're going to do. We're going to listen to you with open ears and try to pursue and help you along your path.
Wow, thank you. Well, we're going to transition a little bit over to men's health, and we're gonna shoot that over to Tim. How you doing, sir?
Doing well.
All right.
All right. Yeah. So yes, because by me being a man and having some help, I want to talk to Mr. Brown about men's health and disparities that we face as being minorities in men's health. We know that there's some, men don't go to the doctor, men don't seek help, men just, we go to the barbershop and we get advice, we go to different places. Tell me about some of the things that you see in your practice concerning minorities and their health that brings some concerns or thoughts or red flags to you, or some advances, or some some I guess some success stories that you faced since you've been over here in Latta, the big town.
The one thing I was shocked about is the lack of compliance. Sometimes you only want to come when you're hurting or something is going on. Other than that, the A1C could be out of whack, the blood pressure could be out of whack, but if they're not hurting, you're not going to see them. And a lot of things that we missed that Dr. Duncan didn't mention, women's health, of course, but it's prostate. Prostate issue creeps up on us because, especially prematurely, with these folks that drive trucks, the people that sitting all the time, that prostate will creep up on them. But some of the disparities is, I think a lot of Black males are just scared to go to the doctor. They're afraid, and sometimes there's a seriously overly concerned with all the other health issues that are going on. They're concerned about ED more so than they are with other things. And that's what a lot of males, not just Black males, but with a lot of males, they're focused on the erectile dysfunction more so than the other things. Have you seen that also, Doc? Yeah, and it's kind of sad when if I can get all this straight, then that will come in line. We don't want to jump over all the other stuff and go to that and not worry about the other stuff. Get all the other stuff straight and get the mind straight, then that will come. But sometimes we got our priorities not straight.
So go ahead.
And that's true because, first of all, there's a fear that you might find something wrong with me. I'm sorry. Go ahead, all right.
No, you good. Go ahead.
So a lot of times there's a fear that if me and the next week, I hear a lot of guys talking that, yeah, man, I'm scared to go because they might find something. Well, that's the purpose of having a doctor, because if there's something wrong, you need to find something wrong with me until I went with you guys and started taking this medication. Before that, I had, everything was taken care of. Have you seen occasions since you've been practicing that that you was able to find some issues with some people and able to save them and able to, actually save their life? I mean, I know some that you did, but would you mind, just talking about that a little bit?
I saw a couple people that I know. One, his gallbladder was about to rupture on him. He's either gallbladder or appendix, one of them. He was steadfast that he was going to go home, but I had to talk to him, not as a physician, but as a friend, and just explain to him, look, if you go home, you're going to die. You go home, you're going to die. So you need to really go. Sometimes you have to just talk to him like you would if you were in the street, and explain it to them and break it down to them and let them know they're not going to see tomorrow. And once you break it down to them like that, when they look at you, they know you're not talking at them, but to them. Then they really get that relationship. Then they'll go ahead and go. Because a lot of people they don't want to go to the emergency room. They don't want to go to the hospital. They want to stay overnight. They want their routine. They want to go back home and figure out they can fix it there. But if you tell them that tomorrow may not be here, then you can get them to go. And I find I'm very good at that, the relationship part or relating to them part, especially Black males that I know, because I'm from this town, so I can get them to go.
And so, we have measures that have gaps that need to be closed concerning men's health. What are some of the things that you're finding very difficult for you to close those gaps on, and some of those measures that's difficult for you to meet, and as partners to help people understand that this is important, that we get you in to have these things done because it can lead to a better outcome in life? What are some of those things that you are seeing that's really, really difficult to meet when it comes to men's health?
hypertension is number one, and that's with male and female, but hypertension is number one because they're not hurting in particular. The head, unless the head is hurting, they're feeling dizzy, that one's a hard one. And as soon as they take the medication, a little dizziness, a little sleepiness, a little fatigue, they're going to back off and don't want to take it, or they may forget to take it, or you may not see them again, or they run out. Hypertension has been the biggest challenge yet, and trying to get them to stay compliant, trying to call them, trying to track them down. The numbers aren't working, or if they answer the phone number, that's been an uphill battle. Hypertension really has, because you're trying to use this blood pressure medicine, and when you're trying to throw it at them to get one that works, it's hard to get them to take the first one, let alone if that one is not effective, do another one. And you don't know if they're taking the medication like they're saying, are you adding on, are you not, should you? Dr. Duncan's hypertension team has been a tremendous help to see what's going on, if they are taking it, somebody to aid me and go out in the field and see the environment, see what they're doing, how they're doing, and if they're doing anything causing any stresses. But that has been an uphill battle, is the hypertension, trying to get it under control.
And so we know that in the Black community, that because of diabetes and because of hypertension, there has been an increase in patients going to dialysis.
Yeah.
Right. And so catching them early and getting those numbers in control early, that process. But I think there needs to be more community education that these are the two things that lead to you having to go to dialysis, because once the filters in the kidneys are destroyed, they don't regenerate. And so having hypertension kind of help it really affects your renal function. So I think more education of those two things in the community, more about preventing people from going on dialysis. So that would really help a lot, because I know a lot of people in our community, some that I didn't even realize had kidney issues, that was going into kidney failure or renal failure, now taking dialysis, and they're young men, so what do you see we can do? What can we do? You and Dr. Duncan.
Yeah, I can jump in. So I do think education is key, but I think there's two other parts to it. I think transparency is also key. So my first job out of residency, and I came back to South Carolina, I would have patients in our practice or in the community that would pass away, and other members of the community would come in and say, so-and-so up and died. And in my mind, I'm like, they did not up and die. But I can't tell them the reason why they were sick and ill and died. But it was so secretive. People keep things secret. Now, you don't have to go on Facebook or stand up in church and say everything that is wrong with you. I'm definitely not advocating that. But at least within your own family, we should stop the secrecy and know why Big Mama was in the hospital and why Big Mama died. And it was because her diabetes was uncontrolled. She didn't take her blood pressure medicine, and Big Mama still wanted to smoke. Well, that's why it happened. And so I think making sure that we are transparent, at least within our own family, about the medical conditions. And so putting two and two together to see that these are the things that added up to either dialysis or just not having a good, fruitful life because you're so sick is important. I think the second thing that I wanted to say is trying to make sure that we are trying to not be okay with these conditions being a part of our community. And I guess the other way to say that is it's so commonplace to have so many family members with diabetes and high blood pressure and these chronic conditions that I feel like, particularly the African-American community, we're numb to the diagnosis. Oh, I just got a touch of diabetes. I got a touch of hypertension. There's no such thing. you have a chronic condition that can cause damage and shorten your lifespan and make you not live healthier. So I think being transparent and also not being okay with it being commonplace are also two ways to help us out as a community.
To piggyback on what Dr. Duncan said about we're complacent with the diagnosis or numb to the diagnosis. I hear so many say my mama had it, my daddy had it. I tell them all the time, you may have a genetic predisposition, but it's not a genetic predestination. You ate what your mama ate, you ate eating what your daddy ate, but you can't do that. You got to change the way you eat to change the way you live. It's not necessarily a destination. You don't have to end up with that. You just got to do a little better.
Yeah, we often hear when folks talk about breaking generational curse, but it always is in terms of finance and never in terms of health, right?
Mm-hmm.
We talk about breaking that generational curse and
Absolutely.
not being in poverty and being able to provide for your family financially, but we never think about that in terms of overall health, you know. Where diabetes run in the family, like generations and generations and generations, hypertension and generations. So I think if we and two clinicians on, and as well as Daniel, who's also a nurse by trade, if we break that cycle of thought process, we could probably see some improvement as future generations come about.
Yeah, I definitely agree, Marek. And even to the point of, connecting the two, your health is your wealth. And so because you have these chronic conditions, your life expectancy is shorter. So that is a shorter amount of time that you are able to build wealth for the upcoming generation. So wherever your priority is at the beginning, then we can place health in there because it's pretty hard to make money and grind, as people say, if you're at the dialysis center 3 days a week.
Exactly.
Right.
Right. Wow. So go ahead. So Dr. Duncan, we heard the word earlier from Daniel, gaps. We don't want to get too far in the weeds because we're gonna definitely have you back because it's been a while since you've been back and your team has expanded over in population health and value-based care. But talk to us about gaps from a clinician point of view and why it's important for us as an organization. Why we patients, if they hear that word gap or if center staff hear that word gap, why is it important to close that gap?
Sure. So what we're looking at is prevention, and also in terms of looking for things before they come about, and also proactively managing conditions that we know about. And so when we say the term gap, that means that there is something that our patient needs, either prevention wise or in terms of monitoring their current condition that they don't have. So that's the gap, what they need versus what they don't have. And so that could be things that we've talked about already on the podcast, like mammograms and colorectal cancer screening. And then as Tim Brown talked about, proper management of your blood pressure, proper management of your diabetes. And so that's what we're talking about in GAP. We're really trying to get healthcare to where we are not just treating disease, but we are helping you prevent and be aware of things early.
Absolutely. What's the saying? An ounce of prevention is worth a pound of cure.
The cure. That's right.
Yeah. So yeah, absolutely. So we definitely, Duncan's team, they're reaching out to individuals every day to get them in for those preventive screenings and preventive care. Get them into clinicians like Tim Brown to be able to address those incidents of diabetes and hypertension. So we definitely appreciate you all coming on today. This was some great information. And hopefully, so the information that was provided today, we are able to help break that generational health curse and have future generations on a path of better health. We shrink those disparities that we have out there among people of color and everyone else. Um, Before we leave out, can we get the two clinicians give us some parting words? Anything you wanna leave with folks as we close out?
Um,
You can go ahead, Tim.
Go ahead. The thing is that I encourage you to try to lose that weight. Get out and walk, exercise. I think weight is a huge issue also. I see that a lot, and they don't want to say it's the weight, but weight is a big contributor of a lot of the issues that we have having with the diabetes and the hypertension especially. But come on out, get screenings, get out and exercise, walk, do the best you can with what you have, but and eat better. It's mainly what I want to say.
Thank you.
Yeah, I would say, to Daniel's point, yeah, we are looking for stuff. That's our job, right? Because we want to catch things early. So don't run away from us. We're here to do the best for you, and also come prepared. Don't just show up. Know something about yourself. Know something about your family. Come in ready to do some work when you go into your appointment for your medical care, because we're trying to do the best for you, and we need all the information possible.
Absolutely. And like you said earlier, it's a partnership. It's a
That's right.
partnership. Yeah.
It is. Yeah.
Yeah. Well, thank you again. It's always good information. Always a good time when you guys come on, because when we leave y'all and y'all leave, everybody leaves with some great information. We leave with little nuggets that's going to help us. And as the provider said, come in, get your screenings done. If you don't have a provider, we can provide that for you at CareSouth Carolina. Give us a call. Call the call center. Any CareSouth Carolina number you dial will go to our call center, or you can dial 866-498-0399, 866-498-0399, and their person will be able to direct you to where you need to go to make an appointment. Or you can go to our website at www.caresouth-carolina.com, www.caresouth-carolina.com, or follow us on Facebook, like us, and follow us on Twitter, YouTube. But we're just here to help. We can get you set up with an appointment to see a provider, establish care, and we go from there. All right. Again, thank y'all for coming on. Thank y'all for being willing to impart some wisdom in us today. And we'll see you next time.